All right, it is 2:05, so we'll be letting more participants in throughout the seminar. And for now, we're just going to get started with our introduction. So we are Advocate for Lives, a youth-led organization that raises awareness for both blood and organ donation, as well as health-related research. And before we begin, we're just going to go over a few housekeeping rules. So please don't spam the chat and keep any messages in the chat relevant to the seminar. And of course, make sure that there's no swearing or inappropriate language. We'd appreciate if everyone would keep their mics muted so that we can have no interruptions throughout the seminar. This session will be recorded, so you've probably already gotten that notification, and we just do that so that we can post the recordings on our YouTube channel for anyone to watch later on. And for anyone who would like volunteer hours for this seminar, please rename yourself with a name you'd like on the certificate. We'll explain more about the volunteer hour process at the end of the presentation. But for now, if you could just rename yourself in Zoom, that'd be awesome.
Okay, so now that we've got that out of the way, today we're going to be talking to Dr. Sajjad Fazel. I'm sorry if I pronounced that incorrectly, but he's currently working as a senior public health consultant and a postdoctoral associate at the University of Calgary.
And we'll be addressing all the questions you have through the Google Forms and any in the chat at the end of the presentation. So without further ado, please take it away.
Thank you, and thanks for inviting me here today to speak with all of you, and also anyone else will be joining in later or on YouTube. So yes, I'm a public health researcher. I work on a variety of portfolios, and I'll be explaining a little bit about my journey, what I do, and some life lessons that I've learned through my career journey and things that have helped me in my career. So my journey started in Tanzania. I'm an immigrant who moved to Canada, and I think we've covered that. My journey took me 9 years in total across 6 cities, 3 continents, with the one goal of making sure we have equitable health for all. So I was born in Dar es Salaam, Tanzania, which is a coastal town in East Africa. Lovely warm weather throughout the year over there. We don't have these cold winters the way we do over here in Ontario. When I was in high school, I used to like being involved in various activities. We had a chemistry club. We had some sports clubs. It was fun getting engaged, and it definitely helped me increase my curiosity. That's what led me to like science subjects more, and biology in particular. And then when it came to grade 11, I had to choose whether I'm going to the science subjects or the art subjects. So either physics, chemistry, or biology, or commerce and business, and I chose science. And then when I was in grade 12, I started exploring various careers. I looked at biotechnology, I looked at pharmacy, I looked at medicine, nursing. And what I ended up with was the clinical pharmacy. I found it as a very interesting field. And I thought, okay, why don't I explore this path? The reason I chose the health field in general was because my dad suffers from type 1 diabetes mellitus. And having seen him suffer from the disease, I thought I want to do something about this, help him and others like him. And so I ended up in the healthcare field, and particularly chose a pharmacy. One of the things that I would like to advise anyone when you're thinking of a career or field is don't only look at the end goal, but also look at how you will reach that end goal or what it takes. So for example, if you want to become a doctor, get into MD and medicine, then that could be the end goal. But what's the process that will get you there? You'd probably have to do residency and spend a lot of time in the hospital. It's quite a lot of hard work getting there. You may have to do deliveries of babies and inject people and look at blood. So there's a number of things that you have to be prepared for. And I always say, look at the process, not only the end goal. Maybe you want to become a software engineer. Then what does that involve? You have to be good at mathematics. Are you ready to spend that much time of your day sitting in front of a screen. Maybe you like going outside on adventures, and maybe wildlife type of careers might be suited for you, something in the tourism industry. So look at the entire process and not just the end goal. Are you ready to get through the process? Are you ready to stomach through it and push through even in times of difficulty? This is a question you have to ask yourself. And then I moved to Manipal, India to study the Doctor of Pharmacy degree. Once I decided I want to do pharmacy, I looked at some various universities. India had a very affordable and high quality education. So I went there. And during my time, I also did voluntary work in various industries. So there was a time I volunteered in a retail pharmacy. There was a time I volunteered in a hospital pharmacy, in an industrial pharmaceutical company. So I did that to explore my opportunities and just learn how the day-to-day activities are, right? So while you're doing your education in university, if you do have the time to do some voluntary work, to reach out to various organizations and see exactly what is the day-to-day activities of various careers, I would advise you to do that. It's good to get that hands-on experience into fields that you're interested in, and it sort of quenches your curiosity, but also gives you a bearing of what you may like and what you may be interested in within that field that you have chosen. Every field is wide. There's so many things you can do, and this is how you sort of get that feel for the land, as they say. So I had good enough grades when I finished studying. And I did a lot of voluntary work in terms of helping underprivileged population with health camps, going to orphanages, and providing health services as well. And so this was the time to explore, learn, and experiment. And then I moved back home after I graduated with a Doctor of Pharmacy degree. I moved back home to Tanzania. Pharmacy, medicine, these are all regulated professions. So this is something that you have to keep in mind also. If you want to work outside of Canada, you'd probably have to do licensing examinations and maybe an internship to practice in another country. And even within provinces, there are very small steps, but there are still steps that you have to take in order to be licensed in another province. So keep that in mind. These are regulated professions. And so I completed my internship. I worked in a regulatory authority myself and in a national hospital. And then I was working full-time as an assistant manager of a hospital. During my time in Tanzania, I noticed that there was a rise of non-communicable and chronic diseases such as heart failure, diabetes, obesity. And these are diseases that can be prevented through lifestyle modification, right? Through having a balanced diet, through exercising, reducing smoking. But the disease was on the rise and there wasn't enough educational campaigns in Tanzania. The local language there is Swahili. Many of the resources by WHO and some of the other larger organizations are in English. So it wasn't reaching the masses and in the population in general. So I started an online health promotion program where I would take material and information, some complex materials from research as well as some of these reputable websites. And then I would translate it into the local Swahili language, into bite-sized chunks, infographics online, and sort of educate the public. And the program was a huge success. I got to work with the media on various radio and television shows. I got to work with the Ministry of Health as well, making an impact. And while I was there, I also involved with Global Shapers, which is a great organization to be involved in. It's part of the World Economic Forum. They have hubs all over the world, including over here in Toronto, in Ottawa, in Calgary. So wherever you are from in Canada, they have hubs. It's a great place for youth to meet other youth and work on projects. I also was part of the Rotary Club at that time, working on specifically the health care portfolio. And while I was doing all this, I I sat down one day and thought, well, I'm doing public health work. Why not get a degree in public health so that I can work more in this field, right? And so there was sort of a shift in my career from pharmacy to public health. And this is why I put this quote here: pursue your passion. This is how you find happiness. See what interests you. And it's okay to slightly shift your careers or choose a different path. It's all part of life. One of the things that I've noticed among some of the most successful people that I've spoken to over the years is that their path was serendipitous, right? You're flexible, you're ready to adjust, you're ready to adopt as the world keeps changing. Who knew COVID-19 would be there? It's here, so you gotta keep adapting, and our world will always keep changing like this. You have to be ready to adapt. And so I came to Canada. I was in London, Ontario, pursuing the Master of Public Health program. During my time there, I was quite proactive, getting to network with various health professionals and public health professionals from different organizations: Diabetes Canada, Heart and Stroke Foundation, the Canadian Cancer Society, even various people who work in public health units, local public health units specifically. And one of the benefits of networking is not to get a job, but to actually expand your mindset, see what opportunities are out there, and being able to pursue those opportunities later in the future. And then I did my internship, which was part of this Master of Public Health program at Western. It's a great, wonderful one-year master's program. So it's quite accelerated, but the benefit is it gives you the chance of finishing your degree in 1 year instead of 2 full years. And there's a practicum, a 3-month practicum that's part of the program. The benefit of that is you actually get hands-on experience working in a variety of organizations, and they have connections with some really great organizations across the country. And so that's one of the benefits of this program. It's also a case-based program, so it's not didactic learning. You get marks because of how much you contribute in class. You get points for doing project work and even solving cases. So a part of the day-to-day activities in the class is you'd get a case related to public health, maybe poverty, maybe environmental health. How does global warming affect nutrition, for example? And then as a group in your teams, you have to figure out a way of solving this problem, reading literature, coming up with models. So it's quite a fun program to be a part of. So if you ever want to go into public health, I'd say look at the Master of Public Health at Western University. Yeah, and then after I finished my program, I came to Toronto, Ontario. I had family over here. And for 3 months after graduating, I was unemployed. And I was actually looking for a job. So despite having technically 2 master's degrees, I was unemployed, and I was just applying to jobs. I applied to over 100 jobs, and I got a part-time job at Mount Sinai Hospital. And I took that job as a project coordinator, and that was sort of getting my foot in the door. And the lesson to learn here is life has its ups and downs. You have to be patient and persistent, right? You have to be patient and persistent. Never lose hope. Keep pushing at it. Things work out in the end. Maybe some of you who are in high school, one of the most challenging things is maneuvering that sort of friends circle in high school. Maybe those of you who are in university, it's the upcoming exams that are maybe one of the most challenging things that you have to face, or sort of learning from home. But as you go through life and you look back, you're like, oh, that's what I found challenging. That's nothing compared to what you deal with later on. So always keep pushing. The challenges get addressed, and you become much wiser as you go through life. After that, I got a job as a postdoctoral associate and research associate in Calgary, Alberta, at Alberta Health Services. I was working on various cancer prevention research, which I still do till today. I can explain more about the research if you have any more specific questions about what I'm working on later during the Q&A period. So we did a number of research, and then was it? What was it? I think it was in October. Yeah, it was in October of 2019, where we decided to look at cancer prevention research. And we were studying this, how does misinformation regarding cancer specifically spread online? And then COVID-19 hit, and we sort of looked at the situation and changed our research and decided to pursue research in COVID-19 misinformation, which was funded by the federal government. And that's what I've been doing for a while now, COVID-19 misinformation research, studying it, finding out why people believe in misinformation, who is being targeted by misinformation, who are those who are spreading misinformation, and how do we address misinformation? How do we inoculate people from misinformation? Because we know it has detrimental effects to a person's health and well-being. And during this time, because of this research and others, I was involved quite heavily with the media, writing op-eds and commenting on various television and radio shows. So it was a tumultuous start at the beginning, being unemployed, but later on, as you can see, things did work out, and I'm working on a very interesting and innovative and upcoming field in research, which is health misinformation in general. So this is something that what I want to put as the bottom line is you can start a career path and then you can see something else come up and you can pursue more opportunities, right? So just keep an open mind. You might get into medicine and then you might be like, oh, maybe I want to do public health after that. And you decide to go for public health and you become the chief medical officer of health of the province. So there's various paths you can take at any point in time. Just be open and follow your passion, see what resonates with you, what you're good at, and go for it. So that's the end of my journey overall. Right now, I'm currently working on COVID-19 misinformation and cancer prevention misinformation. It's an exciting field, working with various stakeholders, conducting research, and then using that research to actually inform policy, action, and practice. I have combined some lessons that I've learned over the years. These are sort of quotes to live by, as I say it, and I'd like to share some of them with you, and hopefully they'll help you as you go forward in your career. So the first one is focus, hard work, and persistence are the keys to success. There is nothing as important as this statement. It's something that I hold very true and dear to my heart. Focus on what you want to do, work hard, and make sure you're putting in as much effort as you can, and be persistent. If things don't work out, make sure you stand up, dust yourself up, and go back again to work on it, or maybe change your path and work on something else. Is it wrong to focus on a variety of things? No, you can focus on multiple things at the same time. You can even focus on one thing and then reach a stage and say, okay, maybe this is not working out. I want to focus on something else, or maybe complete that whatever task, the career goal, and then say, okay, I've done this. Now I want to do something else. So don't be shy. It's not that if you started at one field or one path, you have to go all the way. That's a misconception. You are free to change, and that doesn't mean you wouldn't be successful. In fact, it will help you grow and get and acquire basically a number of skills, which is something that employers are actually looking for these days. Probably not so much in the past, but these days the work field has become more diverse. The other one is opportunities are like buses. When one goes, another one comes, but you have to be prepared. So I stole half of this quote from Richard Branson. I'm sure he won't mind. So opportunities are like buses, and actually they do come along. I don't believe in an opportunity of a lifetime. I don't think that ever exists. There are great opportunities that will come by your path, and you might be like, oh no, I really need to take this opportunity. because maybe such great opportunities are few, but it's not like there's an opportunity of a lifetime. Doesn't exist, not true. So always look at yourself. Are you prepared and are you ready to take that opportunity, right? So maybe you want to pursue a course or a degree, but you at that particular point in time you don't have the financial means, or maybe you have some family commitment that you are not able to do it. That's okay. You could always say, I'll come back to it later. That doesn't mean you push things off just because you don't feel it, or you're getting complacent. But don't think that you have to push yourself and just to get an opportunity that you feel if you don't get it, you won't be able to progress forward. So be open-minded, keep looking for opportunities, and make sure that you are prepared when it comes. And if you're not, that's okay. Another one will come, and that's something that I can tell you from what I've learned. Opportunities always keep coming. You just have to keep your eyes open and be ready. This quote I like. It says, everything is figure outable. Take it one step at a time. And it's true. There are times maybe you have already faced some difficulties, some challenges. It can be something small, it could be something significant in your life. And later on, you see that things actually worked out on its own, or you actually found a way to solve it. Maybe spoke to colleagues, spoke to family, and you are able to address it. So everything at the end of the day is figure outable. There are difficult challenges, there are simpler challenges, but in hindsight, everything would be achievable and figure outable. So just keep that in mind, especially when you are in times of difficulty or stress due to this pandemic. A lot of people have stress about careers, about studies, family stress as well. So keep it in mind, everything is figure outable. Plan yourself how you go forward. Try to address the important things. Take time out for your own personal mental health as well. And everything will work out in the end. Gratitude and empathy are important in your career. I think this is something that is overlooked today. So, for example, you applied for a voluntary position, you got it, you got that experience, you are able to put it on your resume, and you even learned some new skills. Be grateful for that, because that person, that company, that organization, out of all the applicants, they chose you. So you have to be grateful for that. Your teacher maybe referred you to a course or a program. Be grateful because they actually thought of you and they referred you to do something that will develop your own future and your career. When you're in university, make connections with your professors. They're very well connected and well known in their field. That's how they've reached where they've reached. So work with them and be grateful when they look out for you and help you pursue opportunities. Maybe they are your reference when you apply for a job. So make sure you're always grateful, and also be empathetic. Might be working in a group. Somebody is having maybe some family issues and stress. They're not able to submit certain things on time. Be empathetic. Try to be understanding. I think we need more empathy and understanding in the world. It helps us all live in harmony. You're at work. Somebody is grumpy that day. Try to be understanding. If it's a one-off thing, why they're grumpy, try to help them out as much as you can. So gratitude and empathy in your career and even in your personal life will go a long way. And finally, it's about everyone needs to have a fat cow. And this is something that I actually believe in. Now, what is a fat cow, right? I don't mean getting an actual cow from the farm. Fat cow is a word that I use to describe a massive project or a significant project that you are working on. Always have something that you're doing that is significant, that you're passionate about in all stages of your career. So maybe you're in university and you're working on a research paper with your prof. You got it published. That maybe is your fat cow. That's going to help you get into med school and med apps because you have published a research paper. That's going to help you get into a research career later on. So that's your fat cow. It's a significant project, that you're passionate about, that you've worked on, that you have achieved, and that you can use then to pivot yourself to more opportunities. When you're at work, you're doing your day-to-day activities. Maybe there's a particular portfolio that you're interested in. You work on it, it becomes successful. You use that maybe to get a rise in the pay, or maybe you use that to get a higher position, right? You go from coordinator to manager, maybe. So always have this sort of fat cow in mind, something that you're working on that's going to actually help you pivot to better things in the future. And I mean, I've done this in the past, and I always advise everyone to do this as well. So when you're maybe applying to university and you want to stand out from the crowd, how do you stand out from the crowd? You put in that fat cow. You say exactly what you have done and what you have achieved, a particular project. And it doesn't have to be part of schoolwork or part of your job. It could be something totally different, a side gig, a side project that you are working on. It could be having webinars and seminars where people talk about careers like this one. Or it could be something different, maybe going to an orphanage or starting an NGO, fundraising for a good cause. It could be a variety of things. It's just something you're passionate about and that you can use in the future to pivot yourself. So that's the end of my talk. You can connect with me on social media. I'm available on LinkedIn, even Twitter, at Sajjad Fazel. And I'll be happy to respond to any question now or even later on if you personally message or DM me on LinkedIn.
Yes, thank you so much for your presentation. And so just to begin, we're going to move on to the questions that the participants have already sent in before. But participants, while we're answering these, if anybody has any more questions, just feel free to drop them in the chat and we'll get to them.
For sure. So one of the questions we had from the forum was, how do we maintain our health, especially after being vaccinated? And does the key lie in keeping a good diet, or is it much more than that?
Okay, could you repeat again? There are two parts of the question.
Yeah, so I can repeat it over. The question was, how do we maintain our health after being vaccinated? And does the key lie in keeping a good diet, or is it much more than that?
Okay, so great question. So first of all, after you've been vaccinated with both doses of the vaccine, depending on where we are in the situation in the world, if depending on how many Canadians are vaccinated, it's best to still follow and adhere to public health recommendations. We have seen a few cases in Alberta where health professionals who have gotten both doses of the vaccine have been infected with COVID-19. This happened very recently with the Delta variant, which seems to be more deadly. So I would say, at least for the near future, if you have been vaccinated with both doses, you'd still need to wear a mask and socially distance, right? Now, of course, it depends a lot on where you are. If you're outdoors, there's a lot of ventilation. That also reduces the chances of being infected. So that's something to keep in mind. If you're in a place that's less crowded, like an outdoor park, it reduces the chances of being infected. But I think unless and until at least 75% or 80% of Canadians are vaccinated, fully vaccinated with both the doses, I think we'll still have to follow the public health recommendations, and that will still be in effect. Or at least you'd be smart to be cautious and follow that. In terms of living healthily, it's a number of things. Yes, diet is important, but diet is just one of them. And when I say diet, we're talking about having a balanced diet, right? I'm not talking about this keto diet thing or, starving yourself and whatnot. Some other wellness influencer or Gwyneth Paltrow stays out there. She is not a health expert. You should be listening to health experts and not some celebrity. So I think so making sure that you have a balanced diet overall, you get your nutrition, that's one. Exercise is another one. Exercise has been known to prevent various types of cancers. So just having exercise in itself, a half an hour every day or at least 5 days a week is important. The third thing is sleep. something that a number of us ignore these days, with being online and on TikTok until late at night, until that guy shows up and says, "Hey, you've been scrolling too much on TikTok." So I think one of the things to keep in mind is getting 8 hours of sleep. It has been tremendously beneficial and also prevents chronic diseases overall. So we're talking about diet, exercise, sleep, and then finally, I would say it is making sure you take care of your own mental health, right? The pandemic hasn't been easy for anyone. It's definitely caused stresses, a lot of anxiety. So taking time out, and it could be anything, right? Whatever you find reduces your stress, whatever lets you calm down and think things through, whether it's sitting in a bathtub with a bath bomb or actually going for a walk on one of the beautiful trails here in Ontario. It could be anything that makes you sort of calm and rest. It could be reading a book, and maybe about Harry Potter, wonderful book, and sort of thinking about Voldemort instead of other things. So I think you could be, it's important to practice self-love, and taking time to get away from stressors and triggers in your life.
Okay, thank you for that great answer. Our next question is, what would you say are the best and worst parts of your job?
That's interesting. Okay, so as a researcher, one of the best parts is especially we're doing implementation research or knowledge translation part of research, we actually look at what the data says and we recommend policy and practice. So that's the fun part, making an impact towards the community in general and making long-term massive impact. So for example, one of the projects that I worked on was smoke-free campuses, right? Advocating for universities and colleges to ban smoking. A policy like that has massive benefits, right? First of all, it's better for the economy because there's less people having lung cancer in the long term. It's better for the health and well-being of those students and staff who are at that particular institution. They're less likely to get lung cancers and other cancers in general. So it has massive benefits working in policy and practice, and sort of translating that research. It's quite rewarding. The sort of downside of the job is it can take a very long time to make a policy change or to implement research, right? You need to have the right political movement and mindset for that. You have to get that window of opportunity where the environment is right, where people are ready to make that change, where leaders are ready to get on with that change, where there's funding to implement these programs. So I think the amount of time it takes, that could be something that's sort of the downside of the job, that sometimes you have to wait, or sometimes you are ready to work on a project, but maybe the stakeholder, the government, the organization is not ready, so you have to put it in the back burner. So that's probably the downside of the job.
Yeah, for sure. I think you brought up some really great points about both the advantages and disadvantages of the job. Another question we had was, what are some of your day-to-day tasks? For example, maybe your daily routine or anything like that.
Yeah, so that's interesting. So currently, because I'm working on COVID-19 misinformation research, it does start off with, depending on the type of research we're doing. So we recently published a study on misinformation on Instagram. So part of my day job was to go through Instagram. It's funny getting paid to go through Instagram, isn't it? Sounds like a good job. And so you go through social media posts, specifically at looking at COVID information and highlighting the COVID misinformation that's there, and then analyzing the posts, using qualitative analysis, and seeing what are the themes of misinformation out there, how much engagement does different misinformation get, what is the correlation. So for example, one of the things that we found in our study was that a lot of COVID-19 misinformation was hand in hand going with anti-government government mistrust, anti-government sentiment, as well as other conspiracy theories such as the earth is flat, right? Flat earth theory, and all these other funny conspiracy theories that people actually believe in. And what we found out is that once somebody is susceptible to believe in one type of misinformation, they are more likely to believe in other types of misinformation. So the job does involve collecting some data, analyzing it, and then coming up with recommendations on what needs to be done in terms of policy and practice.
Thank you for that answer. So the next question is, how do you balance work and life, and do you have any tips in that regard?
Yeah, that's a good question. It's important to balance work and life. And I think it also depends on what field you are in, right? So if you are starting your residency in medicine, then it can be difficult because you have shifts. If you work in pharmacy, you also have shifts. You could have a weekend shift. You can maintain your work-life balance because some of my friends who are pharmacists here in Canada, they work 3 days a week and they take 3 days off, right? But they work for 15 hours in those 3 days that they work. But that's just the way they have set up their schedule, right? And they like spending those other 3 days with their family. I work in research, and so I have a 9 to 5 job. And so that means after 5 p.m. every day, I get to spend time with my family, and I get to relax. And I like that model. So I think it depends on the job you're in. One thing to keep in mind is that your job is your job. Your job could be your passion, which is wonderful. Then you're making a bigger impact and you're happy to do what you're doing. But at the same time, it's good to keep time to relax. It's good to keep time for family. And it's more about priority. I think at the end of the day, it's about prioritization. I don't believe that when people say, oh, I don't have time for X, Y, Z. No way. It's about prioritization. If something is not at the top of your priority list, then it's going to be down. Then you'll probably be more happy to spend time on Instagram than even maybe talking to a relative or a friend, because maybe that's not something that you prioritize. So it's not about how much time you have. Even with the little time that you have in a busy day, you could still prioritize maybe family, maybe relaxation, maybe going out for a walk. It's just about making sure that it's high on your priority list and you get through it. So just think about what are your priorities in life, and make a checklist, and then make sure those things get the most time.
For sure. I think that's some great advice. So we did have a question in the chat, and the person is asking, you mentioned you have applied to over 100 jobs. In your opinion, what is one of the most important aspects of a job application? How do you make yourself stand out from other applicants other than the fat cow advice you gave?
Okay, that's a good question. When you apply for a job application, you usually start with sending in your resume and possibly cover letter, right? So the goal of submitting a resume and cover letter is to get an interview, not to get a job, is to get an interview. So it has to be succinct, maybe 1 to 2 pages long, maximum. You need to make sure you specify what you have done in your previous job. So when it comes to, this is like a class on writing a resume, you have your summary, you have your name, date, details, email address. And then when you explain your experiences, you have to explain using the terminology that's used in the industry. And also you have to be specific and say, what is the outcome? So for example, those of you who arranged this webinar, right? You could say organized an educational webinar for students aged whatever to whatever, right? Invited X number of guests, right? And so usually I've seen some resumes where somebody says, organize a webinar for students. Yeah, that doesn't give enough information, right? How many guests did you invite? Putting a specific figure, maybe there was 10 guests that have come. How many webinars were there? Maybe there was 5 webinars. So being specific in a resume does go a long way, because it gives somebody that picture, oh, this is real. Then somebody saying organized webinar for career development. It's too broad. It doesn't give specifics. And usually when a recruiter is reading that, they're like, yeah, but I'm not sure what they actually did, right? So writing what you actually did, quantifying whenever you can, even if you just invite, let's say, 2 people, a figure 2 is better than saying some, right? So having those figures there, that's important for your resume. Making sure what the outcome was. So for example, you do a survey after this, and a number of people benefited from it, then you can include that as part of your resume. So having that sort of outcome, what was the point of doing that? Maybe you volunteered in Relay for Life for the Canadian Cancer Society, and maybe you fundraised. So saying that you fundraised X amount that was used for maybe, let's say, buying wigs for children who have cancer, right? So having that exact line in your resume, I think that's important as well. In your cover letter, then you can be a little bit more fluid, you can be flexible, you can explain a story, you can explain where you got your skills from. And those are some of the important parts of getting that interview. And then when you get that interview, that's where you're trying to get the job, right? Resume, cover letter to get the interview, interview to get a job. And when you come to your interview, then you can explain more exactly about the scenario, be more passionate, and that's how you end up getting a successful job.
Yeah, thank you so much for that amazing answer. I feel like resume advice is always important, and not a lot of people know about like things like that, right? That like the fact that you need to write a resume to get an interview. But yeah, so that's it for all of our questions. And thank you so much for giving us this amazing presentation. Would you like to give any final comments?
Yeah, I just want to say that a lot of you have seen COVID-19 and will be going into a post-COVID world when you are in university or even start your careers. Keep in mind that you have gone through a pandemic. You survived a pandemic, right? You've gone through a huge major life event. So if you could get through COVID-19, probably anything else is possible. So have that thought in mind, be positive, and go out there and achieve your dreams.
Thank you so much. So just for our participants, make sure to fill out the form that will be posted on our Linktree tonight in order to receive your volunteer hours. And a certificate will be sent to you by email sometime this week after Monday. So if there's no more questions, then we'd like to thank everybody for attending the seminar. And remember to follow us as well as follow Dr. Sajjad on Instagram in order to ask any more questions. Thank you, guys.
Thank you.